In this technical video, we present an arthroscopic technique of glad lesion repair using suture bridge technique along with panlabral repair. Our case was a 37-year-old male who was right-handed dominant and came to hospital with complaints of recurrent shoulder dislocation for 2 years. He had history of sleep dislocations too. His apprehension sign was positive at 60 degrees abduction and 30 degrees of external rotation and had full range of active and passive movements. Coming to the preoperative imaging, the image on the left is an MRI axial cut showing an anterior labral tear which is marked in red, posterior labral tear which is marked in orange, and a possible glenoid articular cartilage disruption which is marked in blue color. Image on the right hand is a CT sagittal cut showing anterior inferior bone loss of 11%. Coming to the technique, after creating all the standard portals, here viewing through the antero-superior portal, we can see the unstable glad lesion in the postero-inferior quadrant of the glenoid. Yes, here the plan is to reattach the cartilage. We want to create the biology by doing aggressive debridement of the glad lesion bed by using the aggressive shaver till the bleeding points to be seen. As we had seen in this case, the glad lesion is in the posterior inferior quadrant of the glenoid. The first attempt is to repair the posterior labrum at 7 o'clock position. Here, through the posterolateral portal, using the cannula, the bite was taken through the same. And you can see here, we have used the 1.3 mm tape and planning to use the knotless 3.5 push lock anchor. After drilling with the 2.9 mm drill bit, here we are using the 3.5 mm knotless push lock anchor at 7 o'clock position. The threads were brought it. We kept 4 mm apart from the insertion site so that we have enough tension on the posterior labrum when we hammer the push lock anchor. So this is the posterolabral repair using 3.5 knotless anchor. After inserting the anchor, one limb of the suture tape was taken through the antero-inferior portal so that it can be used to repair the cartilage along with next anchor. The next anchor is planned at 5 o'clock position by doing the antero-inferior labral repair. By using 25-degree lasso from the antero-inferior portal, we have taken the bite and we have taken the new 1.3 mm suture tape and it was shuttled through the same and planned to do 3.5 mm push lock anchor by using the same threads through the antero-inferior cannula. Along with that another tape which was used for the postero-inferior labral repair. At the same time, we have to make sure that we have reduced the cartilage well in place, and as you see that we had a firm pressure on the cartilage when we fixed that knotless anchor. After creating the first suture bridge between 5 o'clock and 7 o'clock position, the next suture bridge is planned between 8 o'clock and 4 o'clock. Here, again, the one limb of this anchor has been taken through the antero-inferior portal and that is used along with the knotless anchor at 4 o'clock position. By creating that second suture bridge, as you see here, with the well-reduced glad lesion, creating the second suture bridge. You can see that after inserting that anchor, the cartilage lesion is well sandwiched between the anterior and posterior labrum by these two suture bridge technique.